We'll move on to the next process called as catheterization. Every year there will be huge changes in this IVR coding, interventional vascular surgery, because what happens is now bundling takes place. In the sense, if a physician wants to do a procedure, certain parts of the procedure are included in it. Long are the days where we used to code separately for every part of the procedure. As every year there are CPT changes, what happens is, especially with the IVR coding, what is happening is there is going to be one global code, okay, which makes the coding much easier. In spite of that, we need to know what is catheterization. Catheterization is nothing but the process of navigating the catheter into the desired anatomic site. So whichever site you are going to treat it, or you are going to make a diagnostic study, there you are going to place a catheter. For example, the physician has to place a device into the right side of the heart, so he is moving via the veins, okay. Or if the physician wants to place a device into the left side of the heart, he is going to make the catheter pass via the femoral artery. From the femoral artery it goes via the aorta, abdominal aorta, thoracic aorta, arch of aorta, and then into the left atrium. So this is called catheterization, okay. Here there are two types of catheterization. When the tip of the catheter terminates in the aorta, it is called non-selective catheterization, okay. But when the tip of the catheter extends further from the aorta to any of the vessels, it automatically becomes a selective catheterization.